Schwartz Centre rounds came from America. They were first devised by the Schwartz Centre for Compassionate Care in Boston, America, and they were brought over to the UK in 2009 by the Point of Care Foundation, who hold the licence for people running rounds in the UK. And they were devised in the memory of somebody called Kenneth Schwartz, so they were named after him. He was a lawyer who died in the mid-90s of lung cancer, and while he was receiving his care, he recognised that the smallest acts of kindness from the staff that were looking after him made the unbearable bearable. And he recognised that some staff were able to do these, to share with him and to give these smallest acts of kindness, and some staff weren't, and on some days some staff could do it and some staff couldn't. And he wanted staff to receive support so that they were able to provide compassionate care. He recognised that there was a gap there, and so Schwartz rounds were developed in his memory, and they are a facilitated forum that are open to all staff, usually held monthly, where staff come together to share pre-prepared stories about the emotional, ethical or social impact of their work on themselves. And it's a facilitated forum for any staff, and it's a chance for them to reflect on the impact of the work on themselves and put themselves first. So we argue that it's a countercultural space, as that's different from their normal work in the NHS, where obviously patients come first. So I was here today to share findings from a national evaluation that we finished last year. We were funded by the National Institute for Health Research, and we conducted a mixed methods longitudinal study with 2 phases to look at who's implementing Schwartz rounds, how they're implementing Schwartz rounds and how they might work. And we weren't asking the question, do they work? We were asking, how do they work, why, for whom and in which context? So it was something called a realist evaluation. And so we tried to unpack the kind of key components of rounds that enable them to produce outcomes. And the sorts of outcomes that we found they produced were that we certainly found that they had an impact on staff well-being. So we measured psychological distress at 2 time points in 9 organisations, in 500 members of staff, and we compared people who attended rounds over an 8-month period with people who didn't attend rounds. And those that attended regularly, the proportion of people with psychological distress at a clinically important level halved, whereas in the non-attenders there was virtually no change over time. We also found lots of evidence for impact on improving teamwork, improving communication with colleagues and with patients, improving empathy and compassion for patients and for staff, and some real examples of changes to practice as well. But this was all contingent on them working the way that they are meant to work, which is by creating a safe space, and they have a skilled facilitator who's trained, who works with the team with a clinical lead to create that safe space, and to bring staff together who tell stories that highlight hidden roles and experiences. Because it's a group setting, you get multiple perspectives on a topic or on a theme or on a patient case, and they work by kind of giving people an opportunity to sort of bring down the hierarchies and the barriers in healthcare, and to get a chance to kind of see the person in the professional, and to get a chance to sort of reflect and resonate on their own work. So the premise behind Schwartz, when they were developed, was that by giving staff an opportunity to get insight into their own feelings and emotions and their own responses, would enable them to better link to their colleagues and their patients.